My journey's kind of been on and off as far as being directed versus a little bit gray area, but I'm from Flint, so I'm a Flint native. I went to Carmen High School and graduated. After that, I thought I wanted to do engineering. Like I was good at math and science. All my teachers were like, yeah, you should really do this, and catering's here. So I went to Michigan in Ann Arbor and got a chemical engineering degree. But during that process, I just wasn't quite feeling it. I thought I was gonna go into pharmaceuticals, but one summer I was doing an internship and volunteering in New Orleans, and I just realized I really wanted to do patient care. So my senior year at Michigan, I decided to finish my engineering degree, but apply to this thing called medical school and figure out how to be a doctor. So I eventually got into Georgetown University, graduated from there, and during that process, figured out that I liked family medicine, which means I see adults and children, that I can have this whole spectrum of care, but also be a really good community doctor and get into public health and policy work. So I specialized in family medicine, and I always knew during this path that I was gonna come home. I was lucky enough to land in Flint in 2020 after my residency. I was at home taking care of my community and really excited about that process. During that time, I just had more challenges when it came to like really providing care and having that continuity and impact that I wanted. And I realized that in the system that I was in, and it wasn't quite working for me or my patients, and I wanted to do something different. So that's where direct primary care and Harris Family Health kind of came about. Me going out on my own and starting my own clinic was a process, but doing the direct primary care model of not accepting or billing insurances and doing this monthly membership-based primary care service made it more accessible to a lot of people and a lot more inviting and different. Harris Family Health is Flint's first direct primary care clinic. At its base, it's new, it's innovative. People aren't quite sure what it is, but are like, this makes sense. This is how I should be accessing care. And it just simplifies a lot of things. Instead of being complicated or complex or gray area when it comes to insurance and knowing if it's gonna cover something or if you're gonna be able to have enough time with your doctor, it just kind of says, I am trying to provide good medical care to my patients, and I'm also trying to have them have a good patient experience. So with Harris Family Health, I can offer more time. The average amount of time in the traditional system is 13 to 16 minutes. That's including like getting there and going through the hallway and talking to these other people, and you might get that full 13 minutes, but you also might just get 8. What I'm doing is offering people up to 60-minute appointments, and that's very flexible. If you're like, Dr. Harris, I think I need more time than that, then we just kind of work that out. Like, I'm not bound by the idea that you have to have an appointment for me to talk to you. I'm not bound by the idea that you have to go through all these people to get to me. Like, I'm here for my patients. I'm trying to be a resource so they can get more time with me. They get more direct contact. So instead of going through phone tag or a call center, they get my direct backdoor number as a patient member line. They're able to call me during business hours, after hours, and knowing that I'm answering.
Hello, this is Harris Family Health. This is Dr. Harris speaking.
So this innovative path really spoke to me. I committed to it. I built up the process of learning how to do the business side of medicine and just business stuff in general, and combined that with my medical knowledge and started Harris Family Health. And we are fresh and new and in downtown, and I'm excited for what we can do for Flint and Genesee County. Being someone who was raised in Flint, to come back and practice medicine and be like a doctor in the community, it's really morphed my perspective of what's going on in the community. If anything, this has made me a lot more steady. As people have learned about it, I think they realize that at the minimum base, they can prioritize their health. But there's so much potential with Harris Family Health and direct primary care in this county. It's gonna be a beautiful thing when people realize that they can take care of themselves and it makes sense. And it's just like going to the grocery store. It's just like going to some random mom and pop place. I'm just providing primary care services. I really feel like during this process, I've realized how many people have not been accessing care. I knew there were people, in my previous job, people would come in and say, oh, I haven't been to a doctor in a while. But as I've gone through this journey of opening up Harris Family Health, more people that I know on a regular basis were like, I haven't been to a doctor in forever. I don't actually have insurance. The last time I went, it cost this much. And I'm just cringing at the aspect that now I'm offering something that people are like, oh, it only costs that much? that relief on their face and them kind of like turning the wheels of saying like, maybe my health isn't something that I need to like brush under the rug. Maybe it's something that I actually can put forth and prioritize and take advantage of this new thing. I'm hoping that Harris Family Health is not the first and last direct primary care clinic in Flint. And the beauty of the, awareness, campaign stuff or just talking to people about Harris Family Health is they recognize, one, that it's a little bit weird over there in the traditional system, that it's not really always focused on the patients, but knowing that there is a way across the country for people to access care, I think just is a beautiful thing. When I decided to go out on my own, relearning about the details of the 100K Ideas pitch competition was kind of a little bit of a game changer in the sense that I was doing this with no funds. So that was an opportunity itself to possibly get some money to kind of spearhead this and support this. Even though I didn't win the pitch competition, I won the People's Choice, which is great. So I'm like, that was even more like, oh, the community likes this. Like, they're like, you might not have won the big one, but we want you. At the time of the competition, I was only a couple weeks into people knowing. That was the first time I had kind of got it off of my living room couch and out of my family's conversations and actually into the community. And so the pre-sessions before the pitch competition helped me really develop what I was gonna say to people, why I was doing this as far as a consumer standpoint or a community standpoint. I knew what I could offer as a doctor, but people are very, I won't say stuck, but people know the insurance system. People had no idea what direct primary care is. I'm like, how am I gonna share this? I have no idea. And so going through the sessions leading up to the pitch competition and me going through those exercises and realizing what I should say, what I shouldn't say, how I should say it was a nice challenge. And then to finally get to the pitch competition, to say this in front of people that I don't know, to have it live streamed, to be like, okay, so this is when the Flint community and Genesee County community is gonna really hear what I'm doing. But it was just so exciting. That September competition really, it took the dust off of everything. It was like, nope, you're showing it, it's out there, let's do this. But having at the beginning when I was really raw in the process of being a business owner was really great to just grow and learn through that challenge. And so I appreciate that experience. If there's someone who has an idea, if it's in infancy or just kind of some random thought, I think the first advice I would give is just to start, even if it's a small thing. But there are so many resources in the Flint and Genesee County community that even the smallest idea can be nurtured into something. Once you verbalize something and it becomes a lot more real, you find out that there's so many other people who are like, I can help you connect with someone, or I can help you with this. All these things start happening once you get it out of your head and just verbalize it. Surprisingly, there's a lot of people who, even if they don't know how to help you, there's still supportive people out there. They're like, I don't know what to do with your idea, but I really want you to keep at it. And even those nudges of encouragement can really bring some great projects and businesses into the community. So the future question is interesting because I'm very fresh into the beginning, but immediately I just see kind of a slow growing medical clinic in downtown Flint. Broadly, I really want direct primary care to not just be Harris Family Health in Flint and Genesee County. I really want, the medical students, the residents, even people outside of this county to slowly start bringing direct primary care more into this space because I think it's a great alternative for people to have. I ultimately want Harris Family Health to be this thriving medical office. So the vision is for Harris Family Health to be on the second floor of a storefront and there to be some art gallery community space on the first floor. But there's so much potential with Harris Family Health and direct primary care in this county. As people have learned about it, I think they realize that at the minimum base, they can prioritize their health. So being able to just offer people that kind of just another notch in their belt as far as a tool for their life and what they're planning on doing is really exciting. If anything, this has made me a lot more steady in a sense that I don't plan on leaving my own clinic and keep this option as something that's continuous and stable in the community. I don't want it to be gone in a year. That's not the plan. I want it to be thriving for multiple years and to be the base for other people who eventually do come into the community and start their own direct primary care clinics.